With me now is Dr. Shane Fryer. He's the president of the Australian Dental Association. Shane, thanks very much for joining us.
Good morning, Jason.
Just how bad are Australians' teeth?
Well, we know that about 65% of the population go to the dentist now, but it's 35% don't go, and in that group there's some disasters as far as oral health goes.
What are some of the worst examples that you've seen?
There are people that have got teeth that have rotted away to the gums. There are people that have got large carious lesions, people needing to have teeth removed, and people needing to have teeth replaced. It's extensive and it's a very large problem.
And what are the reasons for why it's so bad?
Access to dentistry is difficult for this 35% of the population. We know that cost is one of the issues, but it's also people living in rural and remote areas, people in different population groups, Aboriginal and Torres Strait Islanders, people with special needs. So it is a varied. There are a varied number of reasons why people aren't getting to the dentist, but we know that it's about 35% of the population that are the ones that we really have got to target.
And children in particular are affected. One of the options as a solution in this report is for a special subsidy for children. That would cost about $3 billion a year. How would that help?
Focusing on children is focusing on the future. If we can solve children's dental health or get children up to a good level of dental health, that's what's going to hold us in good stead for when we become adults. We know that your dental condition as a teen or dental condition as a child will have a direct relationship of your dental condition as a teenager, will have a direct relationship of your dental condition as an adult. So focusing on children is of paramount importance.
So it's about creating habits.
Correct.
Good habits.
Correct.
Now, more broadly, how much money do you think is needed to fix the system?
Well, the country's spending about $7.7 billion on dentistry now, and that's for about 65% of the percentages that I spoke about before. If it's going to be a proper, good quality dental care and not a two-tiered system, the costings could be in excess of $10 billion annually. This is why the association is saying that given the current fiscal constraints that we all know about, funding needs to be targeted so that that group of people that need the treatment now are going to get the same quality of care as the more fortunate in society.
Do you think that there is the political will to commit that much amount of money, given that the government needs to get a surplus in the budget?
I think there's the political will, but again, it's the fiscal constraints. The government has to balance their budget just like we all do, and the report has given the Minister a number of options for her to take to Cabinet for consideration on what they're going to come back with for us as a community for our public dental needs.
What do you hope the Health Minister will do with the report now?
I hope that the Minister's going to read that report thoroughly. We don't think that a broad brush approach is the way to go. We hope that it's going to be a targeted approach. The three key points that the Dental Association believes are important is one, the focusing on children, because as I indicated earlier, that's the future. Two, targeting and addressing the waiting lists. The waiting lists are significant. Over 500,000 people need treatment and they've been on the lists for a while. And thirdly, something that can be forgotten is oral health promotion. Messages out to the community, similar to what we do with our obesity campaigns and our smoking campaigns, because again, that's the future. And if you control disease now, prevention, we all know, is a much better than cure.
Okay, Dr. Shane Fryer, thanks for joining us.
No problem, Jason.